So, what is this vasculature that we talk about associated with the heart? Well, just like anything else, it needs a good deal of nutrients, oxygen. We do a lot of chemical reactions, need to pump away all the metabolic waste. So, it would stand to reason that, excuse me, that we have a huge vasculature. Now, we're not going to look at every single individual blood vessel that goes and supplies all the various different nuances of the heart. We're going to look at some of the major blood vessels that are on the heart. Okay. Major arteries, major veins, and that's it. Okay. There's going to be a lot more that we are not getting into. When we're talking about blood supply to the heart, we are talking about the coronary circulation. Okay. Coronary circulation. This is when we are delivering oxygenated rich blood to the heart. And that's what those coronary arteries do. Coronary veins do whatever else systemic veins do. They take blood away from the heart. Well, they're taking it away from the tissue, pumping it back towards that right atrium. The thing to also remember, and I'll mention it here, and I can't remember if I talk about it later when we talk about how the heart contracts. Coronary circulation is peak when the heart is relaxed. Coronary circulation is at its greatest when the heart is in its relaxation phase, diastole. Okay. So when this heart is relaxing, and it happens for a few milliseconds, that's the optimal time for blood flow to be flowing through all these coronary vessels. When the heart's contracting, it's generating force, and that force is a compressive force, and that's going to compress these tiny little blood vessels that live along and run along the surface of this thing. Okay. So when it's going through systole, contraction, blood flow is not going to be optimal. It's not going to be moving at all, to be honest, or it is very, 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 very slow. And now think if you have a blood vessel on the heart that's occluded, that's blocked with fat within it because you have a horrible diet. You could have a genetic defect, but I'm yelling at you if you have a bad diet. Okay. Not if you have bad genes. If you have a bad diet and you eat a lot of fat and you get the fat buildup within these arteries associated with the heart, man, good gosh. Even when the thing's relaxing, it's not going to have great blood flow. And what happens when nobody gets blood? It dies. And when ischemia occurs here when the heart, that's a death sentence for a lot of different structures of the heart. So here are some of the major arteries that we have going on here. We have two biggies. The two biggies are the right coronary artery and the left coronary artery. They come off right at the base of the ascending aorta. Right as the aorta emerges off and up off that heart there, you will find these two arteries. One branching to the left coronary artery. One branching to the right coronary artery. As you can see on that right side there, that right coronary artery gives off two major branches, the only two that I ask you to know. Gives off the right marginal artery. And if you know what a margin is, right? What's a margin? Does everybody know what a margin is?
The space around the edge.
Yeah, just the edge, the sides, right? Like your margins on the papers that you write. That's the edge of your paper that you go to. So the margin, the right marginal artery, just supplies the right border, basically, of the heart. Shockingly, we'll have one on the left side as well called the left marginal artery. As the coronary artery extends towards that right side of the heart, as it gets to that right edge, it branches off, and that's where the right marginal artery comes from. It also continues around the backside of the heart and gives rise to the posterior interventricular artery. So here's my right coronary artery coming off, and as you can see, it gives off a number of branches. I'm not asking you all the other ones. There's my right coronary artery, and then there's the one that comes down the side right there and is supplying the right side of the heart. Basically the right ventricle, but I'm not asking that either. As it continues around this right coronary artery, it continues around, gives off others, but then it gives off a major branch that's on the back side. And that's the posterior interventricular artery. And it supplies basically the back side of the ventricles. Okay, the ventricles left and right there on the back half. Left coronary artery, it's kind of hidden. We have to remove the pulmonary trunk to see it in a lot of cases. But here you can see it as it emerges out right here under this little left atrium here. Here's the left coronary artery, and it branches out. And the first major branch is the anterior interventricular artery, and it supplies basically the front of the heart. The anterior surface of the ventricles on the front, basically. After that anterior interventricular artery, it branches and goes around the circumference of the rounded edge there. That's the circumflex artery. And it's basically supplying the left atrium and a little bit of that left ventricle there on the backside.
So we're looking at the anterior view.
Yes, you
Right.
are. And
But-
the color-coded way it is done for you there, it is dark colored red for what you see on the anterior surface.
Oh, okay.
The lighter shaded red, that's on the backside.
I see. Okay, thanks.
You bet. It's kind of a weird view in that regard. But they don't give another one, which is kind of weird. At least I think. The right coronary artery, what does it give rise to? The right marginal artery and the posterior interventricular artery. Left coronary artery gives rise to the circumflex and the anterior interventricular artery. Takes all that oxygen to those cardiac cells, cardiac muscle. It returns back in veins. The great thing about the heart, and we didn't really talk about it within the brain. We'll talk about it in the next chapter, is the ability to give off multiple branches. As you can kind of see here, we have multiple branches. Okay, we have multiple branches right here off of this right coronary artery right here alone. If there's a blockage here, I have a blockage right there. Well, I mean, blood can still get there. Okay, blood can still come down and get there. It's going here as well. Okay, but it can get over here and can supply these over here that are closer to that blood vessel. The coronary circulation is filled with these multiple channels. These multiple channels exist to ensure that blood gets to everything, even if there may be a blockage. It's called an arterial anastomosis. That's what that fancy word is. Okay. And it ensures that blood gets to the things. Now, Is this going to be effective in the heart? No. These blood vessels are small. And what else is going on here? The heart's contracting. So as it generates force, it's going to pinch off and close these very small blood vessels that are occurring here. So we have this anastomosis, which is great. It ensures that the heart just doesn't die right away. But over time, is this going to be an effective mechanism of perfusion of blood? No. Is this going to be an effective mechanism for how blood is getting to all the cardiac muscle? No. What happens eventually? Well, that cardiac muscle starts to die. And now it can't generate as much force. And you can see that on various different imaging techniques to kind of see how the electrical activity of the heart, and you can kind of see where it's dead and where we have electricity occurring, which is an indicator of life, at least for cardiac muscle in the heart. And there's your blood flow. Again, coronary flow is at peak when the heart's relaxed, diastole, and very minimal when it's contracting, systole. So we have the left and right coronary artery. Left coronary artery is giving me the old circumflex artery and the anterior interventricular artery. We have the right coronary artery branching off and giving me the right marginal and the posterior interventricular artery. They deliver the goods. Well, now we got to bring back all the waste. And these are kind of the four major veins that we have. There are a number of them. There are a lot more veins than arteries generally. And there are a lot of really, really small veins. In fact, some of them are collectively called small cardiac veins. That's how small they all are. And they just kind of clump them up together. So we have the coronary sinus, which we've already seen. We saw it earlier. Coronary sinus sits on the backside, right? In between the atria and the ventricles. We have the great cardiac vein, the middle cardiac vein, and the small cardiac vein. How in the world are you going to remember the differences between this? I'll tell you. Write it down. Here we go. Ready? Okay. It's great to be in the front of the line. So the great cardiac vein, where is it? It's in the front. It's in the anterior interventricular sulcus. What else is there? The anterior interventricular artery. So the great cardiac vein is in the front, and it's great to be at the front of the line. You always forget about the middle child. The middle child always gets shuffled to the back. Where's the middle cardiac vein? On the back side of the heart, in that posterior interventricular sulcus. The middle cardiac vein travels right along with the posterior interventricular artery. Great cardiac veins, great to be in the front. Middle kid gets forgotten, shoved to the back. And then we have a small cardiac vein, and it's basically running along with the right marginal artery. All of these three major veins take the blood, deoxygenated blood, and take it back to the coronary sinus, and the coronary sinus dumps it into the right atrium. Can of corn. Can of corn. Which it means easy. So if for whatever reason you have a blockage or a narrowing of those arteries that supply, any of those vessels that supply, that's atherosclerosis. Or you can have a sudden narrowing that can happen with various different events. Coronary spasm, that can be brought on by tobacco use. Coronary spasm can also be brought on by extreme cold, exposure to extreme cold, stress, emotional stress, cocaine, amphetamines. So that can cause that. That causes that. And then you get into a sympathetic event, especially if you do some of those illicit drugs. And that creates a sympathetic event, and that causes the heart to race, and it's spasming, and it's not getting blood supply, and that's why drugs are bad. But the two major types of clinical views associated with the regions of the heart, and specifically kind of the blood supply to the myocardium, is angina pectoris and a myocardial infarction. Myocardial infarction is your heart attack, MI, right? That is a sudden complete occlusion of a coronary artery. And that is really the difference between the two, is this word right here. With angina, this is a temporary occlusion. Blockage. Okay. With myocardial infarction, it's easy. The myocardium is completely deprived of oxygen. We have a complete blockage of the coronary artery, causes crushing chest pain, severe sweating. It's a sympathetic event. Anxiety comes with it, and hopefully you survive. Or if not, it's not a fun way to go from what I watched with people. Angina pectoris, this is a temporary occlusion. What does that mean? Well, with angina, which is usually how it's just talked about, but it's angina pectoris is the fancy name. When it comes to angina pectoris, it is a partial occlusion. So this, we have a narrowing of the artery where we have some kind of plaque buildup within there, and it's not completely occluded, but it's partially occluded. So with this one, you're going to notice it when you're stressed. Okay, let's say you're running around with your kids, or maybe out running, or you are going up a flight of stairs, having sex. Any of those things that cause the heart rate to really jump, playing basketball, a pickup game of basketball on the weekends, eat like crap during the week, play a pickup game on the weekend. All that strenuous activity, no matter what it's called, will cause that heart to pump harder and faster. Well, now you're going to be blocking that artery, compressing that artery even more, denying oxygen to the muscle even more. And this is when that person kind of gets that chest pain. You get the same chest pain with a myocardial infarction, to be honest, on the left side of the arm, left side of the chest, left side of the jaw. For women, it can be on either side. For men, it's usually just on the left. They can start getting signs and symptoms of the heart attack, but it's not. It's an angina event. Because how do you know? Because they're going to take a break, go on the side, walk it off. The heart calms down, and all the signs or symptoms go away. Are they okay? Hell no. Go to the doctor. If that's you, go to the damn doctor. Or if you see that, tell that person, hey, I'm your friend. Let's go to the doctor. Because that is honestly the difference between life and death.